Weight loss surgery has been proven to prolong patients' life. After smoking, it's the second leading preventable cause of death and fast approaching smoking. And we know that on average, it can increase patients' life expectancy by up to 7 years.
The other thing specific to smoking is that with some of the surgeries, there's increased risk and complications in smokers. There are some GI tract ulcerations that occur in patients that smoke after bariatric surgery. So we definitely like to have people stop smoking prior to any surgery. The age requirements for surgery are, in general, being between the ages of 18 and 60. We don't do any patients under 18, but currently are trying to develop an adolescent bariatric program to help that population.
We've done people into their mid-70s. You have to be a good candidate for weight loss surgery, be able to tolerate the surgery itself, and be able to reap the benefit of the reduction in comorbidities that we see with our patients.
Any patient over the age of 50 will get cardiac clearance, and everyone gets medical clearance from their internist. BMI, or body mass index, is a way that we use to calibrate someone's level of obesity. It uses your height and weight, puts it into a formula, and gives us a number that is generally accepted as a measure of obesity that often the insurance companies use to determine if somebody is a potential candidate for surgery or not.
We have a body mass index calculator on lvhn.org where you can calculate your own BMI.
In order to qualify for weight loss surgery, a general BMI is that of 40. Any patient with a BMI of greater than 40 who has failed medical attempts for weight loss is usually a surgical candidate. In addition, patients with a BMI over 35, both medical comorbidities such as high blood pressure or type 2 diabetes, will also be considered as candidates for surgery. There's many comorbidities that are weight related. They include type 2 diabetes, high blood pressure, obstructive sleep apnea, gastroesophageal reflux, urinary stress incontinence, arthritis, and many other conditions. If you've been diabetic for 1, 2, or 3 years and on one medication orally, you'll actually leave the hospital on no anti-diabetic medications. If you're a tougher diabetic and you've had the disease for maybe 15 years and you're on multiple medications and a high dose of insulin, then it will resolve quickly but at a slower pace as your weight loss proceeds.
We've treated people that are on a lung transplant list with weight loss surgery. We've treated people that have had kidney transplant, that are waiting to get kidney transplants. These are sick individuals that we've been referred to by their specialists because they know that without sustained weight loss, they will not get the treatment they need or they won't reap the benefit of the transplant, in this case, that they need. If you have a significant cardiac problem that would preclude general anesthesia, that may be something that would put the patient at too high of a risk. But often enough, the cardiologists say their obesity is more of a problem than the risk of being under general anesthesia, and if we can get that under control, it may be easier to treat their cardiac problem.